Hello, welcome to Psych 105, Introduction to Psychology. Today we're going to be talking about one of my favorite topics, sleep and dreams. So before we get into sleep, let's talk about the differing levels of consciousness. Consciousness is defined as different levels of awareness of one's thoughts and feelings. There is a continuum of consciousness, the wide range of being aware, from wide awake to totally unaware and unresponsive. The controlled processes, which are activities that require full awareness, alertness, and concentration. And they usually interfere with the execution of other activities. So for example, when you're on your cell phone, texting while you should be driving, that's one of the big issues on the roads today. Somebody thinks they can multitask when all of the research shows that only a very small portion of the population can actually multitask successfully. Then we have our automatic processes, and these are activities that require very little awareness, that take minimal attention and do not interfere with the execution of other activities. For example, eating while you're watching TV. So you're not actually thinking of chewing or swallowing, you're just kind of shoveling food into your mouth while you are watching whatever you're watching. The point between the controlled processes and the automatic processes is that with the controlled processes, there's all kinds of variables that you can't account for. Cars that run a red light, or cars that try to get in your lane without realizing that you're there. Whereas with an automatic process, there's not a lot of variables that you have to worry about. Then there's daydreaming, something that a lot of students tend to do, which is an activity that requires a low level of awareness, often occurring during automatic processes that involves fantasizing while awake. So, you might be sitting in class thinking about what you're going to be doing with your love muffin later that night, while you should be paying attention, but you're just kind of sitting there doodling in your notebook while thinking about what you'll be doing later. Then we have an altered state, which is an awareness that is different than normal consciousness. We perceive our internal and external environment in a different way than normal. And this occurs often because of drugs, hypnosis, meditation, and sleep deprivation. Then we move into dreaming, which is a unique state of consciousness in which we are asleep, but experience in a variety of astonishing visual, auditory, and tactile images, often connected in strange ways and often in color. Then we have the unconscious, and if you've ever had surgery, it's one of those experiences where you have a total lack of sensory awareness and complete loss of responsiveness to one's environment. And it can result from disease, trauma, a blow to the head, or, as I mentioned prior, medical anesthesia. And it is a very weird experience if you haven't gone through this. You go into a surgical area, you are put under, and several hours later you wake up in a totally different room, in a totally different position, and you have no memory at all of what has just occurred. So, interesting experience, but totally bizarre. In addition to levels of consciousness, we have inside of us clocks. We have a biological clock, which is an internal timing device that are genetically set to regulate various physiological responses for different periods of time. So, for example, puberty generally starts around age 13. Which means that you can have kids who start puberty much earlier, and you have kids who start puberty later. Menopause generally starts for women around age 50, and again, you have women who have early onset menopause in their late 30s, early 40s, and other women who don't really get into the menopause part of their life until the mid to late 50s. However, we also have this thing called the circadian rhythm, which refers to an internal regulator that is genetically programmed to regulate physiological responses within a time period of 24 hours, primarily responding to light and darkness. It is controlled by part of your hypothalamus. Your circadian rhythm is basically an internal clock that is running in the background of your brain and cycles between sleepiness and alertness at regular intervals. It's also known as your sleep-wake cycle. So, for example, if you are the kind of person who gets up every morning at 6 or 7 and goes to bed every night at 10 or 11, even on the weekends, you're generally going to wake up at that 6 or 7 a.m. because your body is just used to that. Now, you might say, I can sleep in today, and you roll over and you go back to sleep for a couple hours. But your body has woken you up and said, okay, it's your regular rhythm time. And you override that, and you're basically resetting your circadian rhythm. Jet lag affects us when we lose or gain hours because our body needs to adjust to the new time or the new circadian rhythm. When we have that time change with, fall back and spring forward. Some of us have a hard time with that because, again, our circadian rhythm is so finely tuned that even 1 hour can mess us up for a few weeks till we get used to it. So how much sleep should we be getting? Well, based on recommendations by the American Sleep Association, your average adult should be getting 7 to 9 hours. I can hear you laughing already. Teenagers, 8 to 10 hours. Children between the ages of 6 to 12, 9 to 12 hours. Children 3 to 5, 10 to 13 hours. Children 1 to 2, 11 to 14 hours. And infants 4 to 12 months, 12 to 16 hours. So as we are sleeping, various genetic and biological functions are happening, and we'll talk about that, which is why we need this sleep and why it's so important. It should be noted that while some high achievers, like Florence Nightingale, Thomas Edison, Winston Churchill, are famous for sleeping 3 to 5 hours per night, others, like Albert Einstein, slept for 10 or even 12 hours a night. Singer Mariah Carey claims to need 15 hours a night, but, your average diva always need more hours. So how much sleep do adults actually get? Well, 16% of adults sleep less than 6 hours. That's a really big number. 24% sleep between 6 and just under 7 hours. 31% sleep 7 to 8 hours. And 26% sleep 8 or more hours. So the average adult sleeps about 6.9 hours a night. Now, who are the people who are truly sleep deprived? And these are teenagers. 75% of teenagers are sleep deprived. And we know this because here's what happens. High schools generally start at some ungodly hour in the morning, 7:30 in the morning. So if you're taking the school bus, you have to be out at your school bus at the bus stop 6:30, 6:45, which means you're getting up at 6. Well, most teenagers are not going to bed at 9 p.m. They're staying up till at least 11, oftentimes later than that with their phones, and they are just not getting enough sleep. Sleep deprivation studies conducted on dogs demonstrated that they could survive approximately 2 weeks without sleep before dying. And sleep deprivation is a torture technique used by many governments, including the United States, but it is considered a way of getting people to literally beg for relief. Our bodies demand sleep, and after even 48 hours, you are experiencing the kind of biological changes that you can get from, being intoxicated from alcohol. If you don't get enough sleep, your brain stops physically working the way it should. So here are some theories on why we need sleep. We have the adaptive theory, which is that sleep evolved because it prevented early humans and animals from exposing themselves to the dangers of nighttime predators. So you're back in the cave, and you know that if you go out at night, that the saber-toothed tiger is going to jump from a high perch and eat your neck. And if you go out during the day, on the other hand, you'll be able to see things better, and the nighttime predators are all asleep at this time, and you can go hunt and not get killed. Then there's the repair theory, which is activities during the day deplete key factors in our brain or body that are replenished or repaired by sleep. Therefore, sleep is primarily a restorative process. And again, things like hormones out at night when we are really sound asleep that help us grow and fix ourselves. It's one of the reasons why when you're sick, the doctor tells you to get plenty of rest, because when you're asleep, when you're in a deep sleep, growth hormones are emitted, and that helps repair whatever damage is being done in your body. Moving on to the stages of sleep, there are distinctive changes in the electrical activity of the brain and accompanying physiological responses of the body that occur as you pass through different phases of sleep. First, we have the alpha stage, which is feelings of being relaxed and drowsy, usually with the eyes closed. So you're laying in bed, your lights are off, you're kind of just like, okay, I'm almost asleep, but you're not quite there. Like your love muffin might still be talking to you, and you're making the appropriate noises, grunting, and then you're moving into your non-REM or NREM sleep, where you spend approximately 80% of your sleep time, and it's divided into 4 stages, which we'll address in a few minutes. They're identified by a particular pattern of brain waves and physiological responses. That's how we can divide them up. And you begin with stage 1 and gradually enter stage 2, 3, 4, and this goes throughout the night. You go through each stage, and then you start over again. Then you move into your REM sleep, which makes up the remaining 20% of your sleep time. And this is when you're actually dreaming. So your stages of sleep, stage 1, this is when you're transitioning from being awake to being asleep. And it's that moment of you're just about there. You gradually lose responsiveness to stimuli and experience drifting thoughts and images. Electrically, in your brain, there's the presence of what we call theta waves. And if you look over here on the right-hand side, the picture, one of the sensations that's oftentimes felt at this point is a sense of falling, and you jerk awake. That's called a myoclonic jerk, and it's just kind of a leftover sensation that there might be danger. Stage 2, beginning of what we know as true sleep. High-frequency bursts of brain activity called sleep spindles, so your theta waves have given way to sleep spindles. Muscle tension, body temperature, and heart rate gradually decrease. More difficult to be awakened. You can still be woken up pretty easily, but it's still, now you're getting into that, I'm really getting into some good sleep now. Then you're moving into stages 3 and 4, and this is called slow wave or delta sleep. And this is the deepest stage of sleep. It is the most difficult to be awakened from. People sleep through car alarms, they sleep through earthquakes, they sleep through the baby crying, they can sleep through a lot of things because they're in such deep sleep. Heart rate, respiration, temperature, and blood flow to the brain are reduced, and a marked secretion of a growth hormone. And again, this controls the levels of metabolism, physical growth, and brain development. So again, this is why when you are sick, sleeping is oftentimes the best option instead of trying to power through, because it'll help heal you faster. Then we move into REM sleep. And this stands for rapid eye movement, where the eyes move rapidly back and forth behind closed lids. You pass into REM sleep about 5 or 6 times throughout the night, with about 30 to 90 minutes between periods. REM sleep lasts for about 15 to 45 minutes and then passes into non-REM sleep. And again, this is where your dreaming occurs. Thus, the longer we are asleep, the longer the REM sleep occurs. So at the very beginning of the night, REM might only be 15 minutes. But as you go through and after you've been in bed for 6 or 7 hours, your REM sleep will be closer to 40-minute long. We feel more refreshed upon waking when we have at least 4 REM cycles through the night. And those REM cycles are where we really feel that feeling of refreshed, I've been truly asleep. So here we have a chart of what your sleep cycle actually looks like. So starting at 11 o'clock, you're awake and you move into stage 1, stage 2, stage 3 and 4. And notice that's a pretty long amount of time. You're in a nice deep sleep for at least an hour. And then you start working your way into that stage 2 up to REM sleep. Now you're going to notice around 2 a.m. you've gone through 2 REM cycles. And now you're awake. Maybe you had a bad dream. Maybe you have to get up to hit the ladies or the bathroom. And you go back to sleep and you go back into a deep sleep, and during your cycle 3 you have another REM cycle, you go back into another deep sleep which is shorter, and you go into a longer REM cycle, but you're not quite as deep sleep in the last cycle of 5 where you have your longest REM sleep, which is where that dream occurs right before you wake up that you remember in the morning, or theoretically remember in the morning. So again, what you're looking at in this context is at least 4 REM cycles are going to help you feel better, and that REM gets longer as the night wears on. So the best sleep you have is in the first 5 hours where you have that really deep sleep of stage 3 and 4. And then in that last cycle, that 5th cycle, is where that long dream occurs, that one that freaks you out when you wake up. And you have, theoretically, with at least 4 and even 5 REM cycles, had a great night's sleep. So now we're going to move into talking about some sleep disorders. Insomnia includes difficulties in either going to sleep or staying asleep throughout the night. It is most common specific sleep disorder with short-term issues reported by about 30% adults and chronic insomnia by about 10% of adults. Now, we all have moments where we're stressed out or something terrible has happened and we just can't sleep. But short-term issues with insomnia are things where, you have 3, 4, 5 nights in a row where you just really struggle to get to sleep. Associated with the daytime complaints of being fatigued, you can't concentrate, you can't remember stuff, and you just don't feel good. Now, there are non-pharmaceutical ways to treat insomnia, and a lot of these are things that we love to do that we have to put away. So we only go to bed when we are sleepy. Put out the light immediately. Don't read or watch TV. I know a lot of people like to have the TV on as they're going to sleep. If you're not asleep in 20 minutes, get out of bed and relax in another room until you're tired again. Repeat the previous step as often as required. If you lay in bed and just stare at the ceiling, you're just going to make yourself crazy. Set the alarm for the same time each morning. Basically, what you want to do is get yourself on a schedule, like a baby in a sense. You get up every morning at 7, you go to sleep every night at 11. Don't nap during the day. Once you get your insomnia taken care of, then you can go back to napping. It's not a forever thing. It's how do you fix insomnia without taking pharmaceuticals. Avoid caffeine and alcohol in the evenings. Yes, alcohol is a depressant, but what it oftentimes does is it creates an emotional context where you might be thinking about the one that got away and you can't stop thinking about them. Most importantly, put your phone where you cannot reach it easily. It is so alluring to just pick up your phone, get on social media, or look at the news, or get on Reddit, or whatever your particular website is that you love, and just spend hours scrolling. And the reality is it just does you no good. And follow this program rigidly for several weeks, and eventually your body will get on that circadian rhythm. You're basically setting your clock internally. Now, for some people, all the non-pharmaceutical things they've tried have not worked. So then they try pharmaceuticals, and there's two types of pharmaceuticals that have been shown to work. First, we have our benzodiazepines, Dalmane, Xanax, Restoril. They reduce anxiety, worry, and stress. They're very effective in moderate doses in the short term, so 2 to 4 weeks treatment. But, and this is an important thing, prolonged use in higher dosages may lead to dependence, and we want to avoid that. Non-benzodiazepines, such as Ambien, Sonata, Lunesta, these are becoming very popular because they are less likely to lead to dependence. They are fast-acting, they reduce daytime drowsiness, and there are fewer cognitive side effects. However, they have been, in some cases, shown to cause other issues such as sleepwalking, or in some rare cases, people have experienced suicidal thoughts. And again, your mileage may vary depending on your own experiences, but for a lot of people, Ambien is a lifesaver. Moving on to sleep apnea, which is a condition that exists when a person stops breathing for 10 seconds or longer over repeated periods during a night of sleep. The individual repeatedly stops breathing, momentarily wakes, and then resumes sleep. They do this so many times during the night, they're not getting the proper sleep because they're not going stage 1, stage 2, stage 3, stage 4 REM sleep. Instead, they're constantly waking up. This results in insomnia and exhaustion during the day. 25 million U.S. adults have sleep apnea. That's basically 10% of the adult population in this country. Of that number, 9 to 21% of women have sleep apnea, and 24 to 31% of men have sleep apnea. So it's more likely to occur in men than women, and one of the big risk factors is obesity, so doctors do recommend weight loss. One of the big characteristics of sleep apnea is the sound of snoring that is just, it sounds like a freight train going through the middle of the bed, but the person then wakes up sounding like they're choking, because they are choking. The usual treatment is what we call a CPAP machine, which is a continuous positive airway pressure device which fits over the nose and or mouth and gently blows air into the airway to help keep it open during sleep. So you'll see over on the right hand side I have a little picture that demonstrates how the CPAP pushes the air in and forces the tongue and uvula and soft palate to stay open. The issue there again is the machine can be unwieldy and very uncomfortable, and a lot of people just don't use it enough to get a good night's sleep. Then we have narcolepsy, which is a chronic disorder that is marked by excessive sleepiness. It takes the form of sleep attacks or short periods of sleep throughout the day. It is accompanied by brief periods of REM sleep and a loss of muscle control, which is cataplexy. And it is often triggered by an emotional change, and it is one of the very few medical conditions that is treated with amphetamines. This is not a situation where you're drowsy in class because the teacher is droning on and on and on. Instead, this is an issue that comes about you literally just cannot stay awake. And I've had this occur in class where a student would literally fall out of their chair because they lost their muscle control. And it is something that is kind of shocking to see, but once you do experience it, you kind of know exactly what it is as soon as it happens. Then we have night terrors, which are frightening experiences that often start with a piercing scream, intense fear, and flailing while still asleep, which is then followed by the person suddenly awaking in a fearful state with rapid breathing and increased heart rate. If they don't wake up, they can be hard to awaken and can be confused if you do wake them up. This usually occurs during stage 3 or 4 in your delta sleep. The individual usually has no memory of the experience in the morning. A sleep terror episode usually lasts from seconds to a few minutes, but episodes may last longer. According to the Mayo Clinic, approximately 40% of children experience night terrors, but they tend to outgrow them by the time they are teenagers. So if your child wakes up screaming in the middle of the night, don't yell at them, don't push them. They are experiencing a biological reaction in their body. But when adults experience night terrors, it's often due to stress or an underlying medical issue such as sleep apnea. And again, these are issues that need to be addressed with a medical professional. Nightmares, and we've all had nightmares, and nightmares are not necessarily a sleep disorder unless it begins to interrupt your sleep on a regular basis. Nightmares are visual and auditory dream images which involve great danger, can be very frightening, and produce great anxiety. As I said, they're not necessarily a disorder unless it interrupts sleep on a regular basis. Nightmares occur during your REM sleep, whereas night terrors occur during your stage 3 and 4 sleep. Upon awakening, a person can describe the nightmare in great detail. Most nightmares are a normal reaction to stress, and some clinicians believe they help people work through traumatic events. Nightmares, which tend to be more common in girls than boys, usually begin in childhood before age 10 and are considered fairly normal, again, unless you cannot get to sleep on a regular basis. Bedwetting, also known as nighttime incontinence or nocturnal enuresis. Generally, bedwetting before age 7 isn't a concern. At this age, a child may still be developing nighttime bladder control. If it continues after age 7, it may be an indication of an underlying medical condition, such as an obstruction of the urinary tract. Treatment for children under age 7 is usually taken care of at home, with the parents taking care of the issue. So things like establishing a regular bedtime routine that includes going to the bathroom. You brush your teeth, you go to the bathroom, make sure that everything gets done every night the same way. Waking your child during the night before he or she typically wets the bed and taking him or her to the bathroom. So if you know that the child typically wakes you up around 3 o'clock in the morning because they've wet the bed, you wake up at 1 or 2 o'clock in the morning to take them to the potty. Developing a reward system to encourage your child, such as stickers for dry nights. Talking to your child about the advantages of potty training, such as not having to wear diapers and becoming a big kid. Limiting beverages in the evening, even those last-minute water requests. Kids are great with the I need a glass of water, I'm thirsty. Well, you don't want to have your child be dehydrated, but on the other hand, having to change the sheets every night at 3 a.m. gets really old. And using a bell and pad, which incorporates an alarm that goes off whenever your child's pajamas or bed becomes wet during an accident. And these are available on Amazon and those kinds of places. Sleepwalking, which is one of those scenarios that you hear a lot about, but is not very, it is not as popular as TV likes to make it. Sleepwalking involves getting up and walking while literally sound asleep. It occurs in stages 3 and 4, which is your delta sleep, and occurs most often in children ages 6 to 12, and is generally benign, although repeated episodes you do need to seek medical attention. The person generally has poor coordination and demonstrates clumsiness, but can avoid objects because it's their home and they generally have a pretty good idea of where they are. They're just working on that automatic sense. It's like being really, really, really drunk and coming into your kitchen and pouring cereal into a bowl. You're going to make a mess, but you're not going to, cause havoc, so to speak. The person can even engage in a limited conversation. But in the morning when they wake up, they have no memory of sleepwalking. For adults who sleepwalk, it is usually triggered by stress. People who sleepwalk can also sleep eat, sleep drive, sleep jog. There's all kinds of things, but it is those processes that we've done so often they've almost become automatic. So again, you're not generally going to see someone get up and study for an exam in their sleep because that's not an automatic process. So moving on, we're going to talk about dreams and dreaming. Every person dreams differently because they are often filled with symbols and metaphors, but dreams tend to fit into specific categories. We have release dreams, which help us process and sort through the information we experience each day. Message dreams, where our dream is trying to tell us something. Dreams that predict the future, we are going on a vacation and we dream we're on vacation. Lucid dreams, where you feel like you're controlling the events in the dream. Visitation dreams about dead people or people you haven't seen in years. When you dream about your high school love muffin and you haven't been in high school for 10 years, that would be a visitation dream. Wishful dreams, where you dream of something you truly desire. Oftentimes these come out as sex dreams, and sex dreams are pretty common, so don't feel as if you are, the only one who has them. And then of course we have our nightmares, which oftentimes take place in various and sundry locations that are unfamiliar but with very familiar people. So why do we dream? Well, we have the extension of waking life theory. Dreams reflect the same thoughts, fears, concerns, problems, and emotions that we have when we are awake. Then we have the activation synthesis theory, which is dreaming occurs because the brain areas that provide reasoned cognitive processes during the waking state are shut down. And the sleeping brain is stimulated by different chemical and neural influences that result in hallucinations, delusions, high emotions, and bizarre thought patterns that we call dreams. So, in a sense, while our brain is asleep, our chemicals, our serotonin, dopamine, norepinephrine, adrenaline, all of that stuff is having a party without us. So, in a sense, that's kind of what activation synthesis theory believes. Then we move on to some interpretation issues. So Freud believed that when we are awake, we have a sensor that protects us from realizing threatening and unconscious desires or wishes, especially those involving sex or aggression. This sensor protects us from threatening thoughts by transforming our secret, guilt-ridden, and anxiety-provoking desires into harmless symbols that appear in our dreams and do not disturb our sleep or conscious thoughts. So, for example, one of the most common dreams is if you have a dream about having sex with someone from your family. And of course, Freud totally believed that we all want to have sex with one of our parents. And, this dream would fulfill his belief. The reality is that, it's really a symbolic idea that we want to get closer to that parent, not that we necessarily want to have sex with them. Jung's theory of dream interpretation. Carl Jung, who was a student of Freud but eventually broke away from Freud, believed that dreams are a way of communicating and acquainting yourself with the unconscious. Dreams are not attempts to conceal your true feelings from the waking mind, but rather they are a window to your unconscious. They serve to guide the waking self to achieve wholeness and offer a solution to a problem you are facing in your waking life. So Jung saw dreams as a door that opened you up to solving your problems and an opportunity to figure out how to solve those myriad of problems that plague us during the day. So, anyway, that's it for today's presentation. If you have any questions, please feel free to text or email me. Otherwise, if you are not in my class, please leave a comment and I will respond to you as quickly as I can. Have a wonderful day and enjoy the rest of your day. Thank you.